important things that you're gonna have to learn to do is a bed bath. A lot of our patients are not able to get out of bed and go to the shower or go to the bathtub. So doing it properly is really important, giving them the privacy they need and making them comfortable so they're not getting anxiety every time before you give them a bath. So our patient today is Sally, and she's been a very good patient and she's ready to have her bath today. So you get in the patient's or your client's room and make sure you show them you're doing hand hygiene. Either rub the alcohol or wash your hands, making them feel more comfortable that they're gonna be touched by somebody clean. So before you get your patient undressed, make sure you gather all your supplies. You're gonna need a bath blanket that I have over here. You're gonna need towels. You're gonna need a basin or a bucket of water, a little washcloth that you're gonna use to wash your patient, or disposable bath cloths if that's what you're gonna use. Pair of gloves, because you wanna wear gloves. Make sure you do good hand hygiene before you put on the gloves. So you're gonna grab your bucket, you will add some water to it, and water temperature should be checked by both you and the patient. You're gonna check it by placing your elbow into the water. If it's comfortable to you, then you'll ask the patient to dip their fingers and tell you if that's a comfortable temperature. Also, we're gonna cover her up with our bath blanket. The reason why you're doing this is because you do not want your comforter or your sheet to get wet, unless you're planning to change the sheets. But even then, you want an extra blanket so they're not cold. All right, once she's covered up, then we're gonna remove that sheet and also the gown or the clothes that your patient or client is wearing. Once your client has no more clothes and no sheets, you're gonna start from the top. Grab your washcloth. I wouldn't recommend putting any soap while you're doing her face, especially the eyes. Just simple water. If the patient can help you, that's even better. Give them the opportunity to help as much as they can. And they love to do that. If they can do it, they will love to clean their own eyes. If they cannot do it, then you're gonna start with the eyes. You're gonna start from the inner corner, going to the outer, nicely, and the other side, and then you're gonna go to the rest of the face. You'll get the forehead and the cheeks and the chin all the way down to her neck. This is the time when you're also gonna do her ears. We are not recommending anymore using Q-tips, so just gentle wash on the outside of the ear. We'll take off whatever wax is not supposed to be there. Once that is done, rinse your washcloth, add some soap to it, and now is the time to get down to the chest area. This is the time where you're gonna cover your female patient's chest with the towel. So you add the towel, you take off the blanket until their umbilicus here. Grab your little towel. You're gonna wash from the top as much as you can. Then you're gonna wash from the bottom. Go one side at a time. Make sure you get that area underneath the breast. And then the other one. Also, anytime you wash something, wash with soap, rinse, and then you are gonna dry it. Don't leave any areas wet. Okay, so once you're done with the face, you're gonna move to your arm. You're gonna uncover one arm. Make sure, again, you are washing, rinsing, and drying. Lift the arm. This is, again, a good time to do those range of motion exercises. Ask the patient to wiggle their hands, to wiggle their fingers. Look in between the fingers, make sure there are no any skin breakdown. Also, this is the good time to check for the nails. If you see any of them that are too long or they have rough edges, you can file them to give them a smoother edge. Okay, once that part is done, You're gonna cover your patient up and you're gonna go to the legs. At this point, it would be a good time to check the temperature again of the water. If you need to change the water, then you can do it. You'll start with one leg, you'll go all the way to the bottom. Again, the same thing. Ask the patient to help you as much as they can, bending their knees. This is also a good time when you can do those range of motion exercises, and also to check for those skin breakdowns. One of the most prone area for skin breakdown is the heel of the patient. So make sure you look to see if there are any redness or any open areas. If you find any open areas or any redness that doesn't go away, please make sure you tell the healthcare provider, that being a nurse or the doctor, whoever comes to see that patient. Same technique, you're gonna wash, you're gonna rinse, you're gonna dry. When you get down to the foot, you look through their toes and see if there is any breakdown there, and gently wash them, rinse them, and dry them. Okay. Cover them up, and you're gonna do the same thing on the other side. Lastly, you're gonna leave peri-care, and this is the time when no matter if your water is hot, you are gonna change that water, because you would not want to wash your peri area in a water that you just washed your feet in. You're gonna uncover them, grab that bucket with the water, and just like you hear it all the time, you're gonna clean from front to back. In females, it's really important to not touch the anal area. You do not want any infection brought to the front. I would wipe once and then clean my towel or grab a new one. Don't add any powders or any lotions to their private parts unless they have some kind of redness or any skin breakdown and there is an order from your nurse or from your doctor to add any of those. So once you're done with the front, this time to get to the back side. This would be a good time to also check that water temperature, see if you need new water, and also to evaluate if you need another person to help you. Is your patient able to help you by holding a position when you turn him to the side, or do you need somebody to hold him? It's very difficult to hold a patient with one hand and then try to wash them with the other. Miss Sally here is going to be able to hold the position for me. So I'm just going to ask her to bend her knee, and then I'm going to help her to the side. Okay, trying to uncover her back only. Okay, stay there please. We'll grab our little washcloth here and the same motions. You're gonna wash, you're gonna rinse, and you are gonna dry that area. If you have the time, this would be a very nice time to give them a little back rub. They'll love you forever. So ask them if they want one. Once you're done with the back area, you can bring them back to their back position here. Okay,